Sunday night. I'm so excited. He literally just walked in the door. So it's Sunday night service with Dani and Dr. Motley.
I can't wait.
I'm so excited. How was your week?
Week was good. Very busy, just like yours.
You literally just landed at the airport.
Just landed and just got in from a seminar about hormones and liver. And busy week. How was yours?
Oh, it was crazy.
You're always crazy. Like every time. Like
it was nuts because we're working on the website. We've got a new website that's going to be launched this week. We have a micro course, a 5-day micro course I'm working on that's got to be finished hopefully by November the 11th. It was a busy week. Busy week.
Now the micro course is going to be on
inflammation. This first course, I've never done a course before, and it's going to be on inflammation.
And it's going to rock.
Gut brain inflammation. I don't know.
It's going to rock.
So I hope so.
It's going to be so good. So
well, you've got some stuff in the works too.
Going to do a micro course. Got outline going about like certain micro infections like Lyme and parasites and things of that sort. So I'm working on that as well.
Okay.
And I remember we talked to you. Said you were out there writing stuff on blogs and new stuff this whole weekend.
I am. So all I did all weekend, I stayed in my cuddle duds. There's my long underwear right there. I stayed in my cuddle duds on that couch all weekend
And it's
long.
a beautiful couch.
Well, I just got a new couch. Thank you.
It's beautiful.
It all weekend long and worked. And so they're happy. My website guy's happy. My internet guy, my blog guy is happy. Everybody's happy with me right now.
Everybody's happy with you. But
Yeah,
I knew that you were just.
And I am on day 7 of the detox, by the way.
Dun, dun,
And this is my last detox shake of the night. I just made it. Taste this. I put Adam's fresh turmeric in it from the farmer's market.
Delicious.
I just dropped the turmeric in it. I put fresh dandelion greens in it, the detox shake, water, ice cubes, and something else. I can't remember what else. No, maybe that's it. That's all I put in it.
How do you feel?
I feel good.
You look
great. I feel really good. Yeah, I feel really good.
That's Metagenics, though.
This is Metagenics. I'm on the 10-day detox. Wow. And I feel good. My hands feel good. I'm not hurting. Everything feels good. So far, so good. Okay. Happy Halloween.
Happy Halloween.
I don't have my Halloween costume on. My hair looks a little carrot top. I could be carrot top tonight. Carrot Top and her Asian friend.
That's right.
Dr. Motley.
We gotta make some kind of like dynamic duo like poster or something like that.
We should have dressed up today. I didn't even think about it.
We
Tomorrow's Halloween.
That.
No. What day's Halloween? The 30th or 31st? Oh gosh, I don't even know.
Guys,
I have nothing for Halloween here.
I have nothing either. Yeah.
Anyway,
Happy
so
Halloween.
I want you guys. So this is the very first night that we have done this on the public page, the Dani Williamson page. So why did we make a separate page other than Inside Out Healing from Within? Inside Out is private. That's a private community that I wanted, a safe community for people to be able to share whatever they wanted. Now you're sharing it with almost 6,000 of your favorite friends on there, but it's a safe community. And if anything ever does get a little nasty on there, I immediately delete them because I'm the only one who is the administrator. I'm the queen. That's exactly right. So we needed a public page to be able to share things on, because when you're private like that, videos and things like that, you can't share publicly. So Dani Williamson, I'm trying to transition people off of my private page over to Dani Williamson, which is now linked to Inside Out.
Yep. Okay.
And this is our first time to try it. There may not be anybody watching tonight. So because we don't have that many people on the Dani Williamson page yet.
It'll get there though.
It's linked, so it'll be the same information, but it'll be a little more personal because it's my stuff on there. And then so it's exciting, and you're doing the same thing. You've got a professional page.
A professional page. I need to link mine up.
Yes, you need to link it.
It'll get there. It will. I'll talk to you about it, and I'll talk to Terry about it.
But we are talking about inflammation tonight, and this is a big, big, big topic. I mean, inflammation is the root cause, and I feel very confident saying this, so don't slap me with, well, do you have a randomized double-blind placebo trial behind that, is the root cause of all chronic disease. Yeah. Inflammation from whatever it may be, right? Your diet, your lack of sleep, lack of exercise, environmental toxins, which we're going to talk about, and all. It is the root. And I tell people every day, you weren't born with high blood pressure, high cholesterol, diabetes, heartburn, migraine headaches, autoimmune disease. Most people weren't. I mean, some people may have been born with autoimmune disease. You turned those on through decades of dysfunction, right?
Totally.
Decades.
Totally, yes.
And so our bodies are designed to turn them off.
Exactly. If you can turn them on, you can turn them off.
If you can turn them on, you can turn them off. So I tell people that every single day in the office. So inflammation, the American Heart Association released research, I don't know, quite a while ago. The number one reason for high blood pressure, high cholesterol, and heart attack and stroke was inflammation from sugar intake. Sugar. The American Heart Association. I mean, that's a big deal for them to release that. And you know how addictive is sugar? It's more addictive than cocaine, apparently.
Apparently it is. And we eat many times our weight in sugar.
160 pounds a year on average. The average American eats 160 pounds a year.
Pounds of sugar.
Yeah, isn't that crazy? That's more than I weigh.
Me too. I mean, like everybody was like,
he's a tall, skinny Asian.
Totally. That's exactly right. But I mean, can you imagine eating that much sugar? Like, you know,
no,
you see...
but I used to. I used to take that can of Betty Crocker icing and just eat it like this and eat almost the whole icing. My friend Jeannie Allen knows it. We did it together.
Are you kidding me?
Yes, I know. I mean, yes, it's addicting.
Did you ever have like the Little Debbie Star Crunches? There's little.
No, I don't like Star Crunches. I like Swiss cake rolls, rolls, oatmeal pies, and I love. Oh, for crying out loud! I just went blank on it. Rolled cookie dough.
Oh
my goodness, Pillsbury cookie dough. So I get how addictive sugar is. It's extremely addictive.
And they say that like when you eat sugars or eat sugars within milk, or you know, we talk about gluten, it gives you the same type of reaction as you would to like having morphine. It's such a high to you that you love eating.
Well, sure it is.
Isn't that crazy?
And it's kind of like gluten. Gluten acts like a morphine derative in your body, right? Totally. It's an inflammatory protein. That's why you can eat a whole bunch of rolls at old Charlie's, roll Charlie's, or biscuits at Cracker Barrel. You know, you just keep, you keep getting more and more.
Cheddar biscuits over at Red Lobster.
Oh my gosh, I haven't been to Red Lobster in years. Do you know how? Oh, I used to eat those things, and I would eat the fried Admiral's Captain platter, the fried. I
love that you know, like you're like.
Oh heck, I know. I love bad greasy food. I don't eat it because it would kill me. But so what are the signs and symptoms of inflammation? So anything that ends with an itis, arthritis, gastritis, sinusitis, colitis, vasculitis, Hashimoto's thyroiditis. Itis means inflammation, right? This Latin term, it means inflammation. So what's inflaming you? Well, 90% of the time, it's what goes down the pie hole, right?
It's exactly
very common sense and practical medicine right there. It's what
down
you
the
eat,
pie hole,
right?
Yep.
Yes. So inflammation, there's a couple different. Inflammation is what happens when your body is injured, right? So you cut your finger, you sprain your knee, you sprain your back, you bump your head, right? It's inflammation that happens then. White blood cells go into action, right? They're like an army, boom, and they go right to the spot of inflammation and they surround it and encapsulate it. And that's what creates the redness and the swelling, right? And so that's acute inflammation. That's a good thing. It's the same thing that happens when you have something like the flu or pneumonia, right? Those are good things. Those are good kinds of inflammation right there, the acute kind. Now, our body is designed to recover that acute inflammation. Then you have chronic inflammation. And chronic inflammation, in my opinion, is what's killing all of us. Every single one of us slowly. It's very slow. It is sneaky. It sneaks up on you after decade after more medication. Blood pressure's creeping up, blood sugar's creeping up, heartburn's getting a little worse. So you're put on a blood pressure medicine or a proton pump inhibitor to stop the heartburn, or maybe a migraine headache medicine. It sneaks up on you slowly.
And it's like what you're saying is like some people over the years, they may not quote see a huge physical sign. What you're saying is like, but after a while, it's the subtle things that change over the years that you're not even noticing, and then all of a sudden it gets you like that. Right?
That's right. And so your joint pain gets worse, your migraine gets worse, your heartburn gets worse, diabetes, blood sugar, cholesterol, your fatigue gets worse. Fatigue is a sign of depression too, but inflammation as well. Those small things. And do you know that the American Heart Association, I don't know, there's a study out of Harvard, and it's actually very new, but we knew this this information. or I feel like we knew it in the functional medicine world, C-reactive protein. Like I check a highly sensitive C-reactive protein on a lot of people. C-reactive protein is a protein made in the liver, and it's metabolized there, and it tells us an internal marker of inflammation.
I like
right?
that. I'm gonna write that down. I like the way. Keep going.
Right, an internal marker of inflammation. And what they discovered at Harvard with this study is that if you have if men, this study was on men, women were left out, but if you have a C-reactive protein above 2, level above 2, you have a 3-time higher risk of a heart attack. I'm sorry, 3-time higher risk of a stroke. That's right. And a 2 times higher risk of a heart attack.
Good gracious.
Above 2.
Above 2.
Do you know how many patients I see in my office with C-reactive proteins in the 20s, 18s, 15s, high teens? C-reactive protein is a marker of inflammation. And if your doctor's not checking a C-reactive protein on you, they need to be checking a CRP.
That's right. That's right. And up in the 18s and 20s.
Oh, yeah. And what affects it? Well, it's it's what you eat, right? Mm-hmm. Your diet,
yeah.
Environmental things like smoking are going to raise the C. Well, there's not one problem that smoking helps. Not one.
I can't find
one condition.
No,
I've never told anybody you need to smoke a couple cigarettes a day in order to fix that. I mean, it's ridiculous. Smoking my tail.
You should try like a video sometime.
Yeah, I've never smoked a cigarette in my life.
No,
my mom made. That's a lie. I smoked one when I was 6 years old. My mom made me smoke. My mom made me smoke a rite of passage at home. So my mom and dad were still married. I was in 1st grade. They divorced when I was in 2nd grade. We were at the Memphis Zoo. I will never forget this. And this was in the back before you had seat belts, and I was running around the back seat. My mom was puff, 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 and probably 2 at a time, like she did, just puff, puff, smoke, smoke. And I wanted to smoke a cigarette, and she turned around and grabbed a hold of me and said, "Danielle, smoke this cigarette," and stuffed it in my mouth. And I had to smoke. I puked everywhere. I never smoked a cigarette again. Never smoked. I smoked my first and last one when I was 6 years old. I forgot all about that. Word. Yeah, but it did it. It worked. She still smokes at 73 and now has all kinds of health issues. Ridiculous. But anyway, smoking, environmental, chemical sensitivities, right? Your lotion, your makeup, your hair color, your lipstick, your nail polish remover, your shampoo, your conditioner, your deodorant. Every bit of that creates inflammation. Radiation, cell phone towers, electromagnetic fields, big source of inflammation. Put that phone right on your head. Holy moly. Talk about the inflammation that comes. We could do a whole 2 days on EMFs.
I think we ought to do a thing on that. Really,
I know we should. And also something I've just learned. Well, I knew this, but I've had a mattress. So I'm getting a new mattress this week, or soon I am. Oh my goodness. I have done. Mattresses are huge sources of inflammation.
Yeah. Yeah. Especially like
creating inflammation. Off-gassing, chemicals in there, fire retardants, the foam. I have studied more this weekend as well see all these tabs up here? Those are all green mattress companies there. I don't know where to go. And I can't pay $5,000 for a mattress. I'm not going to pay it. I mean, I could get it, but I'm not going to do that. So those are all environmental things that create inflammation in your body. And then, of course, your diet. You eat a standard American diet, right? If you're eating packaged, processed, bagged, canned, tubed, fake, man-made food, you are creating inflammation, right? Yep. And if y'all saw my picture today of what I ate for dinner, that took me no time to make that. It was amazing salmon, Brussels sprouts with pears in the oven, roasted cauliflower, and broccolini. It took no time. There was nothing that was in a package, box, bag, or can out of that right there. And
I bet you it was the most fulfilling dinner, the most fulfilling food you had, right?
It was excellent. Yeah, it was great. You know, you're on a detox and you tend, here, have some more. It's not wine. So next week we go back to wine, but I couldn't do it. I still wanted to do that tonight. But Adele asked, she wanted to know about an alkaline diet. And, will that decrease inflammation in your body? Well, I think an acidic diet, a standard American diet will increase acid and the acidity in your diet. Yeah. She wanted to know the best kind of diet for an alkaline diet or for optimal alkalinity in your body. I don't do a lot with Alkaline in my office. Do you?
We do. I think that Dr. Rodenbeck in the office, she does a ton with.
She's watching right now, by the way. Hello, Dr. Rodenbeck.
Dr. Rodenbeck, my colleague, and she does a ton with that. A lot of ketogenic. And remember the last time we talked about the virgin diet?
Yes.
And talked about certain greens that can bring up alkalinity. I think one thing that everybody's very careful of is that some people. Do you ever find that in the office that they have pH strips? And a lot of people have pH strips, and there's even different tests that test the pH within the urine. So, like you say, do we do a ton of alkaline diets? It's not that we don't. It's just it depends on the person's if they're actually acidic. You know what I mean?
Sure, and you'd have to check your pH to see it. A saliva or a urine you could do. I never do that. I mean, I just don't. I probably need to. I'm probably one big acid mess, and here I eat so well. And
I tell people that when they come in, if they're going to get very basic, like they would have to give up a bit of animal proteins.
Yes.
You give up a lot of beef. I hate to say that, and a lot of red meats. You're going to have to get rid of that. Acidic wise, and like I say, kales and spinach, and do more greens, more vegetables and fruits are the way you're going to get more alkaline overall pretty quickly. I would say
you're right. You've got to up the greens.
You do, and really you have to cut out a lot of the dairies. A lot of the dairies can make you very acidic as well. So, and we talked about the last week when you said like some of your patients who like do virgin diet. Some people that come in here in my office and do those kind of things like. Their acidity just goes completely down, and they're fighting off infection like crazy.
Well, the more acid you are, the more free radicals you're going to create in your body, and free radicals are damaging to your body, right?
Exactly.
And
free radicals are what they call reactive oxygen species, and what the body does is create oxygen to fight off inflammation, to kill off infection. And the problem is, in an acidic environment, we find that bacteria, viruses, parasites, yeast all grow within acidic environments, and your body would create a reactive oxygen species to help fight them off. So if you keep the acidity going, you're just going to keep creating reactive oxygen species, which means we need more vitamin E, we need more vitamin C, more alpha lipoic acid, CoQ10,
glutathione, N-acetylcysteine, every bit of that.
It'll absorb those free radicals. And so, but alkaline, keep it simple, reduce your animal proteins, your dairy, get up on the greens, get up on the vegetables, and every color fruit you can. And find out what you're sensitive to, like do the ALCAT test.
So this is what I talk to people about. We do Dunwoody and ALCAT at the office. I'm doing more Dunwoody right now because of the insurance involved. Yep. So these are my food sensitivities that just came up. You all can't see that. It's not terrible. Honestly, the only severe reaction I had was dairy. Goat's milk, cow's milk, casein, horseradish, and pecans. And pecan pie. Thanksgiving is coming up. Pecan pie. Those are the so dairy is one. I'm just lumping that into one. Horseradish and pecan. So really, I only had 3 severe. Oh, look at yours. I had a few moderates, and then I had. Let's hold ours side by side. These are our reactions. Oh, look at Dr. Motley's. So.
Oh my word.
Oh Lord. Well, look at Ella's. Ella's was bad too. Ella had a lot of red, as did Jackson had a little bit less than you.
But see, it's like look, it's like Jackson and Ella are like they the green, caution, and stop. Mine's I'm either yes or no.
There's no moderate on you.
No moderate on me.
Yeah. And so knowing what your food sensitivities are was huge for me. That's what turned my life around 8 years ago. Yeah. When Dr. Kalb looked at me and said, "Do you know your diet controls your pain level, Dani?" Yeah. It's like, what? What do you mean? And when we did food sensitivity, I threw it on the ground. I cussed. I said a really bad 2-word cuss word and said, "I'm not doing this." I got it back the week before Thanksgiving 8 years ago. And
happy Thanksgiving.
Yeah. I threw it under the bed till after January. Didn't even look at it. And so I've worked 8 years though on this, and this is another way to get your body alkaline. Now I am a huge fan. This is one of my all-time favorite cookbooks right here. This is my buddy Caitlin Weeks wrote this, and I don't know if Caitlin's on tonight or not, but the Mediterranean Paleo Cookbook is hands down, in my opinion, one of the best. Once you finish the virgin diet and you figure out what your food sensitivities are and you've done elimination, she's a paleo girl. Oh, yeah. She's grass-fed girl on the internet, and her husband is Mediterranean. He is from the Mediterranean. So they've combined this cookbook, and my all-time favorite lifestyle is a Mediterranean lifestyle. Yes. That is the way. When I was in Italy last summer, I felt better there than I have felt my entire life.
You look like you'd be a Mediterranean girl.
Oh, well, there you go. Totally. I may just up and move there someday.
Yeah, I see like all
I
your
do this long distance. Yeah, right. I'll Skype you all, people. And okay, so diet, Adele, we talked about that. Tiffany had put a question up about arthritic bone spurs and decreasing inflammation, like without surgery, diet.
Diet's the biggest.
Turmeric, SPMs. I'm taking my SPMs now, which we can do a whole show on that, which are actually high powered fish oil that basically goes to the site of inflammation and gobbles up the inflammation. They're a big believer in that. High dose fish oil, probiotics, anything you can, certain spices. Turmeric.
I love turmeric. I love mangista. I like certain types of garlic and cinnamon combinations.
You bet. Capsaicin. Capsaicin's a great spice. Black pepper decreases inflammation. Parsley, dandelion, ginger.
What's the cool thing is, like, everything you get written down. I love it because most people say when they eat those spices that it's spicy. Mm-hmm. And it's just that, almost like homeopathics, you give the body something that creates a spiciness or heat. And what it does, it responds in the opposite way. It actually extracts the heat and extracts the inflammation. And it goes.
Oh, you're so smart.
Yeah, it's how Socrates and they say that's how they used to categorize supplements in cold, hot, wet, or dry. And so they say whatever a person comes in with, they have something that's hot, they give them a herb or a spice.
That's Ayurvedic.
It's just Ayurvedic.
Your pita, right? Like I am.
Vata?
I am hot. I'm the fire one. Whichever one's the fire. Pita. Yeah, your dosha. That's it. It's your dosha, right? I don't know. I can barely speak English, much less that. But
they can, like you say, the arthritic bone spurs, like you're taking those things, like a lot of fish oils, right?
Lots of fish oils. And Heather, you asked about decreasing inflammation. Well, you're pregnant right now, and congratulations, and I am so proud. I told you I was going to help you get there. I did. She said, I saw her this week, and she goes, I couldn't believe it when I told my husband I was pregnant. He said, Dan, it's been 11 years. They adopted a baby last year.
Aww.
These babies are going to be like back to back. It's been 11 years. And I told her, I said, I'm going to get you pregnant, sis. We're going to get your body working right. And the first thing her husband said was, Dani said she was going to get you pregnant. And now she's having a baby. And she has Hashimoto's. And her antibodies have come down to almost nothing. Her inflammation is down. She feels good. I mean, she's nauseous. She's nauseous a lot, but she feels good, and she wants to know how can she keep that inflammation down after pregnancy, because pregnancy, I see my Hashimoto's patients, their antibodies come down beautifully during pregnancy. I think it's a hormone thing. It has to be a hormone thing. My suggestion on that is you have to tighten that diet up, Heather, as quickly as you can after the baby's born, right? Or actually now. And you can take turmeric as a breastfeeding mom, right? Well, actually, pretty much all of these, probably not dandelion, but all of these spices you can, and just eat an anti-inflammatory diet, honestly.
Yeah.
And move your body. What's Dr. Derek Myers say? When you stop moving, you stop moving. And right? It's as simple as that. You can't get any more plainer, more plain. Plainer.
But I would say that, like, when they do the food test, Heather, like if you follow that and just keep away from that and just do what you're supposed to eat.
Your body doesn't lie. Yep. Your food sensitivities don't lie. Now, we had a question from Adele again, which is, in fact, you guys, Adele is my friend from Hippo Hollow Farm. If you have not ordered your chicken or your turkeys for Thanksgiving, you need to do that. Hippo Hollow. Oh my goodness, I can't wait. HIPPO. Hippo Hollow Farm. She's from South Africa.
Oh, okay.
Yes. She has the most beautiful accent. And she was asking about parasites and inflammation and how they cause inflammation and how do you test. Now, I'm going to tell real fast how I test, but you're going to get into the parasite thing. I used a 3-day stool study from Dunwoody. That's a lie, from Genova Diagnostics.
That's what I would recommend.
I used a 3-day stool study. I used to do a 1-day stool study where you poop, scoop, and send it off. And I tell people every day, put that box in your neighbor's mailbox because it says stool sample or something on it, human sample on it. Can you imagine working in that factory or that lab? But anyway, I do a 3-day stool study. It doesn't smell like roses in there. I can guarantee
Dirtiest jobs in America.
Oh my gosh. So I'm going to go down there. Do you want to go? They're in Atlanta.
I'll go.
Actually, okay.
Let's do it.
Let's go tour that place.
Take a video of it when we go in there. And Dani's going to wear a mask. And really like this.
So I do a 3-day stool study where you poop. You have a bowel movement for 3 days in a row, and you're more likely to catch the parasites in 3 days, because you may not catch one with one day stool study. So think about that. If somebody gives you a 1-day stool study, maybe ask for a 3-day stool study, because oftentimes you could poop, send your sample in, and you've missed yeast, you've missed everything.
Yeah.
Parasites cause inflammation. We all have parasites. That's not the question. We all have parasites.
Exactly.
Some create havoc in your body.
Completely. I think that when we were talking about, when you said leaky gut, when we go into leaky gut, how she just said that sugar, when it gets into the system, will destroy the lining within the stomach and create cracks, which lead to leaky gut. And the problem with that is when the lining of the stomach gets injured or gets inflamed, it actually can destroy or actually impair the action of the HCl pumps in your stomach. That's a double whammy, because if you eat food and it sits there and it is partially undigested when it goes down into the small intestine and eventually into the colon, it also doesn't eliminate the small amounts of eggs and parasites and viruses and bacteria. That's what your stomach acid is supposed to do. It's supposed to eat up those infections. And what happens is the infections after you eat it, because we all eat it. We get parasites from what? From our greens, from our beef, and it's a normal part of life. We all have it, like she just said. But what will happen is they can slip between those cracks and jump into your bloodstream and travel all around. So then when your body sees that foreign invader, what does it do? It calls all the like your macrocytes, it calls all your killer cells, and it tries to attack whatever's in your blood. And what she was saying is increased inflammation, because what do? They release the cytokines, which are your inflammatory agents.
Yes.
And that causes other things such as serotonin, histamine, C-reactive proteins to increase. And that's why they'll find the markers in your blood is like because you had that parasite or that bacteria or that virus or yeast floating around. And that's what they literally do. If you do the dark field microscopy, you'll see stuff crawling between your cells. Now, I hope I'm answering the question.
I have patients who did dark field for their Lyme disease, and they saw the spirochetes in there.
You can see
burrowed in their blood. Is that not amazing?
It's amazing. And you say as much inflammation comes from parasite, like she said, you say Genova Labs. There's one called Great Plains.
Yes, Great Plains.
Great Plains does a good one.
Yes, we
test it. We do bioresonance. We do a lot of muscle testing, and we use me and Dr. Stegman, we use resonance device to find if there's the sound or the frequency of the parasite within the body. Because I found out, without taking too much time.
We may run over, guys. If that's okay, you can click your little heart button.
Yes, and tell us that you love us. But basically, all in a nutshell,
tell me they love me.
There was conference on parasites, and they were saying that they have found that certain parasites literally can I don't know how they say it, dissociate their own bodies and split up, so they get smaller, so they're not detected within fecal matter. And these are like top experts within the microbiome field. So but I would say this: Genova is one of the best. I'd say Great Plains is great. Biofrequency, that what we do at the office, is a really great matter, because no matter if it's in the fecal matter, those parasites, you know as well as I do, when we study them, they love to burrow into tissue and they like to hide out.
Yes, they do.
So, but with all the stuff you're taking, all the anti-inflammatory diet, all the spices, wormwood, black walnuts, even garlic, we do certain things like we always exchange like what we give, and those things will pull that junk out a lot of times.
They will. And I like colon hydrotherapy as well. Once you start pulling things out, I really recommend people go to colon hydrotherapy.
Who's that?
Teresa Greco's at our office. She is the body benefit. Oh my Lord. She's phenomenal. Oh my gosh, this is day 7. I forgot to have my colonic. I was going to do it on day 5. Oh, it has been so busy. I cannot believe that. I forgot my colonic.
How can you forget your colonic? I never forget my colonic.
What is that high C commercial where I forgot my, or whatever. I don't remember what it was. But anyway. Daggone it. So anyway, I love colonics to help with I mean, that's not going to get rid of all of the parasites, but I mean, you've got to kill them. Get them out of there.
And they do love to run, and they say that like when you do a colonic, if you flush it, if you kill the parasite, you'll flush them out. But you got to work at killing off the live ones, because they will burrow in and they'll attach themselves to the walls and keep themselves in there.
That's right.
I saw a video the other day, and people are going to think we're gross, but who cares?
We are gross.
We are gross. But I saw a video one of my friends and colleagues sent to me, and they showed a surgery where I think it was in another country, but they did a small incision, showed the liver, and they saw something coming out of the liver, and and it was roundworms, and they were pulling out like 4 or 5 in a human. It was really ridiculously crazy. And I don't want to be scared. I'm not saying that. It was
we all have that kind of stuff.
It's just interesting stuff to see, though. But yeah, go ahead.
We love that stuff. So Adele, those are some of the things that I would do. And then April asked about genetics and inflammation. And her grandmother is 80-something years old. I can't remember, and just been diagnosed with breast cancer. And they eat so clean. And she said, we have a great, life. And I think her dad has some inflammation problems and all. And yes, I do believe that genetics are a piece of your puzzle, but it's just a piece of it. It's like everything else. The study of epigenetics, which means on top of your genes, right? And that research is emerging more and more and more every year on the study of epigenetics. The research shows that we're really only about 15% our genetics. Yeah.
It's what our environment
we turn it on through decades of dysfunction. I mean, so, your grandmother's 80-something years old. I don't know why she was diagnosed with. If she lives a clean life, she eats great food, she takes her supplements, she exercises, drinks good water, etc. I don't know why, but I do think genetics play a piece of it, but they're not the end all be all.
No, I think
that's no excuse to keep eating your Swiss cake rolls or your McDonald's burgers or your supersized Sonic or Route 44 or whatever that's called at Sonic drinks, and say, I'm going to have high blood pressure or diabetes anyway because my dad does or my mom does. That's just crap.
It is crap. I think that when I talk about somebody that lives a clean life, I was just at a conference about methylation genetics, and they talk about like somebody who's lived a very clean life and they had cancer, and without getting too in depth, they say that the cancer is caused by a dysfunction within the cell or the mitochondria ability to absorb vitamin D. And we talk about all the time how the body needs vitamin D, K, A, and E, which are fat-soluble vitamins to help the body absorb vitamin D. And the vitamin D is one of the main components to fight off cancerous activity. Helps you with osteoporosis, immune dysfunctions. And you know what turns on the vitamin D receptor, they say in genetics, is the body's ability to take vitamin B, which we give at the office. Yes. And that actually helps stimulate the mitochondria to accept vitamin D. So if your grandmother, and I don't know what she took, but the 15%, like a small part of the genetics would be that she lived a clean life, but what if her body wasn't able to produce sufficient enzymes to help break down the B vitamin to help her body absorb the vitamin D? And that's one aspect of it, because when we talk about gut dysfunction, I always find this. People have two main things working against them. What they eat, priority, their leaky gut. Second thing is what? Their genetics work kind of against them. Yeah. And so if you can't produce the enzymes to break down properly these toxic substances or absorb vitamin D, because that's what enzymes do. Dani gives enzymes, I give enzymes to break down substances. She may not have been able to absorb the vitamin D, which means that her body wasn't able to probably process certain vitamin Bs. We don't know, but the great thing would be to do this. There's Ancestry.com. Yes. You can do this. 23andMe was good, and I'm not knocking them. I use them at the office a lot. But Ancestry.com, you can do a test for $79, $80.
Oh, really?
Yes, and then you can take that information and stick it into things such as MTHFR support.
Oh, dear. Don't even mention that word.
Yep. Genetic Genie, Live Well, LIVEWELO.com or LLO. But basically, you put that in there. You can look at all the genetic snips.
I've got to do mine. I have not done it yet. Have you done yours?
Yeah.
Oh, totally. I haven't done mine.
Yep. And the funny thing is, we talk about heart rate or rheumatoid such. My family has a high issue of arthritis, and I have all the genetic markers to have it. So, but you're saying if I don't eat well, yes, that's the problem. If I eat trans fats, what you taught, we eat trans fats, sugars, bad oils, processed food. What does it do? It robs your body of vitamins and minerals, which are used to keep your mutations from expressing themselves. That's why you have the problems, because you eat so bad, your body doesn't have enough minerals to create the enzymes to properly work in your cells. So when we talk about eating good food, you need the minerals and vitamins within your food. You need to take your supplements.
That's right.
So the bad food you eat when you're young, like I did, like all through my life, all the sugar I ate, it completely dumbed down my genetics. And that's the part. Like when we say 85% is what you eat, it's 85% of what you eat. And it is genetics. Sorry.
Isn't that something?
And
it's fascinating. But I'm telling you, people, your bodies are made to heal themselves. Absolutely. I'm proof of that. Yeah. I am proof of that. And you got to eat real
good. Look at that.
I feel good. I feel good. I'm on the detox. This is fresh ginger from from Adam, you know, from Earth Research. Is it Earth? Yeah. Earth Research. Yesterday, you saw us at the farmer's market on the live feed. Oh my goodness. I chopped this up and I put it in this drink. And then fresh ginger. I mean, these are easy ways to decrease inflammation, people. All you do is chop it off, put it in your detox, or put it in your stir fry, or do whatever. And apparently this will last on your counter. Ginger will for about a year. I mean, turmeric will for about a year or so. She told me that yesterday. Yeah, it's great. But who asked? Jennifer asked, what are SPMs? SPMs stand for Specialized Pro-Resolving Mediators. All right. And those are specific omega-3s and 6s that are high-powered. I want you to look them up. Metagenics is the lead researcher on SPMs, and they're not cheap. That bottle's $120 for 120 pills, 119. It's expensive. But I'm telling you, my pain went down last week like there was no tomorrow. My inflammation. Yeah, I'm testing it on myself. But they have it on the, you can go to the Metagenics website off of our website, or you can just go straight to Metagenics and read about SPMs. We'll talk about it a little bit later, and I'm going to have Metagenics come in and actually do a lunch and learn on SPMs, because it is the future of decreasing inflammation. But that's combined with, it's not just this is not the miracle right here. That's combined with a clean diet, right? Eating well, sleeping well, moving well, pooping well, decreasing stress, and having community.
That's right.
Right?
That's right.
That's all combined right there. That's what you have to do. It's common sense. It's practical medicine.
It is practical. And I think the way that you put it, where you say, like, when you say you're giving yourself to that person 25, 30 minutes a day, or like when you see them, it's like, isn't that crazy? Like all the things you just mentioned is like, we can only spend so much time with you, the patient, in a day. And it's up to them to start eating well and doing well, you know.
Well, that's right. You know, that, yes. I mean, yes. And it goes by so fast, those 30 minutes. And I realize that you and I, we work fast because people are paying cash to see us. And I don't take that lightly. I mean, that is an honor that somebody walks in that door and puts hard-earned money from their back left hip pocket to see us. And I feel like we have to give them so much information. And sometimes I get complaints, or the office gets complaints, that I just put so much out there to them, that I give them so much. And I never have figured out a balance on that. I just give them so much information that first visit, because I just feel like it's like a fire hose being sprayed at you, but you get a lot of papers when you leave my office, and I really am expecting you to take it home and do something with it. I mean, what good is that money you just spent with me if you don't go home and apply it?
Exactly. It is. It's hard because.
But it's hard. It's hard.
It is tough, and I think people like yourself and like we care a lot. And
I know
I
we do.
Dr. Roden back the other day. I was like, you care so much, you give so much out, but you want them to understand. But it is a lot of info. But but you see the results. You see people that do go home and read all those things, and we see the people that go do it, and they just they heal pretty quick, and they heal
they do.
fast.
The ones who go home and do it, the ones who plant the seed. Our job is to plant the seed.
Yes,
I believe that.
Exactly.
And then your job is to go home and apply that information and make it grow.
Exactly.
Right?
Totally.
And so, talking about caregiving, I have a lunch and learn coming up on November the 10th that is very, very important to me. And it is on caring for the caregiver. Caring for the caregiver of dementia and Alzheimer's patients. So
those people applaud.
Anybody can show up, but my friend Melanie Willem is finishing her master's in nursing, and hopefully at some point, she'll get to be in that office working down the road here. And she is doing a big project, and we are tag teaming together, and we're giving a presentation, a lunch and learn, November 10th, 11 o'clock, on caring for the caregiver. And she has done all the research, and I'm telling you, I'd give anything if you guys would show up. It would mean a lot to me, because even if you're not a caregiver right now, chances are you will be, because every 66 seconds someone's diagnosed with dementia in the United States, and 60% of all caregivers, 60% of all caregivers, are women. No, 75% of all caregivers are women.
Oh, man, I believe it. Oh, gracious.
Yeah. So that's a big
November 10th, right?
November 10th, and the Evite's on the Facebook group. So
it's going to be at the office?
It's going to be at the office. If in fact there's too many people, we're going to try to move it somewhere else, but I haven't gotten permission yet, so I better not say it.
Man.
But okay. that is just touching the tip of the iceberg on inflammation tonight, but we're 10 minutes over.
Wow.
We, just the tip of the iceberg. Diet. Supplements like your probiotics. You know, I use Megaspore. I use Theralac. I use got some good Metagenics stuff. Great fish oil, vitamin D, all of your spices, turmeric. Those are amazing things that lower inflammation. What else do you use to lower inflammation?
I use quite a bit of magnesium.
You bet.
I use quite a bit of noni powder, and I use quite a bit of, like, in herbals and mums. But I say with the minerals, I use a lot of zinc, selenium, magnesium, everything you just mentioned, and magenta, and some schisandra berries. And I know that seems, but these are all like spices and fruits that actually help reduce. I did find this out about inflammation, that one of my friends, Dr. Noah Moose, he was down in, I was in Dallas, and he talked about how when we give somebody magnesium and how it runs their energy cycle, but also helps them sleep. You know, when we give somebody magnesium, some people can come in and take magnesium and they completely flush out. Like, they'll hit the restroom because they barely take any of it. And they were finding out that if you take any form of magnesium, Martha, they were talking about any form of magnesium, and they found out in a certain I forgot where the study was at, but a recent study said that if they go into the gut, the magnesium needs a choline or a choline citrate to bind to the magnesium to create a micelle, which means it bypasses digestion and shoots directly into the lymph nodes, and it actually gives your body magnesium. And many people who take that can take 3 to 4 times the magnesium to calm themselves down, get their inflammation down, without just by using choline or choline citrate. So you take. Well,
we're so deficient in choline. So where are you going to get the most choline? Eggs are one of the big places. Yep. I mean, there's other places too, but eggs are a big one.
Eggs are a big one.
And what do I tell people? Stay away from eggs.
Yep. If you can't do eggs, there's good.
I can't. Well, I can. Yeah, I can.
You can.
Yeah.
Some people can do it.
Every 3 days I can have an egg.
Yeah. I usually just tell people, though, if they're going to eat choline, I get the pills or the powder.
Yeah.
And just put it in water and then take your magnesium with that and then go for it.
I'm going to start doing that with my magnesium threonate, because I started on threonate because it crosses the blood-brain barrier. Totally. And I'm seeing patients' magnesium levels rise just on this threonate. But I may do a little trial on myself with choline then.
Try choline.
See why I love him. He's so smart. See,
I just learned from another person, but like, thank you. But I'm saying the choline would work. But that also shows too that those individuals who have low amounts of magnesium, I would say that choline would be there, because choline is part of your cell wall, right? Right. And choline is also what's produced in your gallbladder. So it could also show that the patient has a gallbladder issue as well. They're not breaking down their fats, which means they're not absorbing D or K or A or E, and their immune's down. So you have a double whammy. Like, you find out so much about something.
Oh, it's so intricate. It is so fascinating. I love what we do.
It's so fun.
I love it.
And I'm thinking about
I spent the first 20 years in fashion design. Can you believe that of my
You're
career?
A fashionista,
and then I turned around and did this. Holy moly. I love it.
I love it too. I think that the new research that keeps coming out, and I saw this too. You know, where they do blood, we do hematocrits, hemoglobin guys, you know, your mean cell volume and such. There's a new instrument, and I know we've probably heard this before you have to go, but there's a device like they do the oxygen meter on your finger. There's another device up in, I think it was Oregon or Washington, that showed that it actually can start telling you what your MCV and such just through infrared. Like, more and more they have a new device out that's like that. I'm like, wouldn't it be crazy if you could take all your blood count with a finger shot?
So he's talking about, for those of y'all that don't know, MCV, hemoglobin, hematocrit, HCT. Yeah, yes, your red blood cells. Checking on your
sorry,
your size of your red blood cells, your shape of your red blood cells, all that stuff. And you know, your red blood cells carry the oxygen in your body, right? So I have all these patients with low ferritin, which is those are your iron stores, you know, and these people have a hard time catching their breath. They are maybe short of breath. Their hair's falling out. Their skin's dry. Their nails are brittle. Their eyebrows are falling out. They're fatigued. They're yawning a lot. I mean, it's interesting. And their ferritin levels are in the toilet. And the range on ferritin is like 10 to 200 and something, really. And optimal is going to be around 60 to 100 for ferritin. That's where I try to keep it. I think one night we will do a Sunday night service on just lab values.
Oh, it'd be fun.
And what optimal lab values are of your TSH and your magnesium and ferritin and all that. But guys, we are 15 minutes over, and I am so sorry, but I wanted to say something. We are rolling out the new website this week, the DaniWilliamson.com website. But you need to go to the website today, all week long, at DaniWilliamson.com. There's a thing that pops up. and it will put you on the email list for whenever I get the inflammation course up and running, which should be in November. Well, but for sure before Christmas, it's going to be up. But go sign up for that. That not only signs you up for that course, not signed you up for the course, but for the email for the course. You're on the newsletter then. Yeah. So you'll be on the newsletter. Go do that. And you have on your website, does it pop up on yours?
No, I need to get that done actually.
Oh, you need to do
I'll
that.
do it. I'll get it on this week, and I'll get on that. And so like we should have a link on there with Facebook and the show and like the Sunday night service. Well, I'll get it done. I'll get it done, guys.
All right, guys, and you can share this page because we'll be doing our page off of this. You can share. You can ask people to join. You have to or to follow. You have to like and follow. I didn't understand that. I don't understand Facebook. You like the page and you have to follow the page if you want to get notifications.
Oh man, I
don't know. It's all crazy. I spent an hour on the phone with my internet guy tonight, and I didn't understand any of this. But
I don't know.
I don't know. It's all too much. And so, anyway, inflammation. Bottom line is, it's the root of all or most, if not all, chronic disease. If you've got migraine headaches, high blood pressure, diabetes, high cholesterol, joint pain, that's inflammation. I mean, good Lord, that's fixable. Joint pain is fixable. I know. I lived that way forever. Yep. If you have heartburn, if you have stomach issues, if you're constipated or diarrhea, if you have anxiety, depression, OCD, trichotillomania, or you pull your hair out and things like that, the root cause of that is inflammation. It is. You have to fix the inflammation. And we have Thanksgiving in just a few weeks. I'm telling you, people, be careful what you put at the end of your fork, because it is either going to heal you or kill you.
That's right.
It is as simple as that.
I love it. That's great. I think that everything you eat in your gut, they say that almost over 25,000 different hormones. People just sort of look at the regular amount of hormones. I said most of your neurotransmitters, your brain chemicals, most of your hormones are created within your small intestine, within your gut. If you eat the wrong food, you're going to think the wrong way.
You bet you are. 90% of all serotonin is in the small intestine.
Exactly right.
It's not in the brain.
Not in the brain.
So when the gut's inflamed, so are the symptoms: anxiety, depression, bipolar, schizophrenia, ADD, ADHD, OCD. You have a ADD, ADHD kid, you fix their gut. And you take the sugar away from them instantly. Look, we're going down a whole rabbit hole here.
We are totally.
We are. You take the sugar, the artificial coloring, the artificial flavorings away from them, and you watch their ADHD symptoms go down. And you put a good probiotic and a great fish oil in their body, you're going to see a difference in these kids. And vitamin D.
You totally. I think that
and magnesium.
Magnesium. You get them on good fats. Think about it. You have a cell wall. Your brain's made up of fat. You keep feeding a child, or they keep eating something that has bad fats. What do? You harden your fats, and you can't get oxygen in there. You can't get nutrients within there. Watch what you eat this Thanksgiving. You eat the bad stuff, it can harden you up a bit.
It's not worth it. It is not worth it. I can't wait for Thanksgiving. I'm in charge of it this year, and it's going to be gluten-free. I'm going to share something on Facebook. I want you all to give me your favorite gluten-free holiday dishes.
Oh, I've got to do that on my website, because people go to websites because I want recipes. And then I'll just give it to my mom and my sister to make it for me.
All right, guys, listen, have a great week. I'm sorry we went over, but I love this. I just love him.
I love her.
Don't you love this guy? Oh, my goodness.
You're so good. Like, look at this. Isn't she great at this? Like, good heavens, you're great at this. Like,
thank you. I love what I do, and I think you need to give back. I think when you've been given much, you need to give much. Yes. And I scraped my way up from the bottom for lots of years on food stamps and TennCare, and oh good Lord, that was the best insurance I ever had. I don't wish I was back on it. But my kids and I, but holy cow, now I don't even have insurance. But anyway, I scraped myself up from nothing. And not that I'm something now, and I don't mean that, but when you've been given much, and whether I wasn't given anything, but it's our job to give back.
It is. It's like,
and I have people tell us all the time, you give so much stuff away. Yeah, you should. You should, because it always comes back, man. I'm telling you can't outgive God. And I'm a big believer in tithing. And when you do what you should do and you tithe, you can't outgive God, and you just can't outgive people. When you give back, and this is giving back, this is fun, and we do this because we love it. But when you help somebody, you feel better. It takes your mind off of your own problems.
Exactly right. We're never going to go into our deathbed. I'm serious. When we get older, we're never going to think I didn't get $20 for that bottle of supplements.
And that's not, I know we give a lot of stuff away. And
like
we give a lot of free time away and a lot of free education, but we do give things away. And you just
love what you do.
My accountant hates me because he's like, what was this? I'm like, I gave to this, or I gave to that, or I donated here, or I sponsored this, and he hates me.
But you know what? It's like, exactly. It's not even about us trying to get something back, or do you get something back? It's about like the joy you feel when you see somebody get better. And there's really, I'm saying in my personal opinion, it's like it's one of the best feelings you can ever have.
It is. It's great. I love it, and it's the season of giving right now.
And
so
we're gonna wear elf ears on our Christmas.
Oh, that's right. That's right.
That'll be like so great.
Oh my Lord! All right, yeah, we should have dressed up today. Daggone it, we could have done the Johnny Carson thing and the big hat. All right, guys, listen. Have a fabulous Sunday. Thank you for tuning in, and share this page because this is where we're going to be live from, and it's all linked up to the Inside Out Healing from Within community. All right,
I'll
have a great week. You have a good week.
You do too.
All right, goodbye. I just love it.